So thanks for the opportunity to speak. I won't talk about a specific program. Actually, what I'll do today is draw on work from my book, Out of Reach, which I think has implications for how we think about implementing the solutions that we might decide today are particularly promising. And the focus of my presentation and of the work that I do is on four key questions. First, how do we actually provide help in our communities and getting an accurate impression of that? Where do we provide that help? Place turns out to matter quite a bit. And then I'll talk about why the answers to these questions of how and where matter to our discussion today. And then I have some ideas on what we can do to improve how we connect low-income populations to programs and supports. Typically, when we think about the safety net, we focus on welfare and food stamps. That's been kind of a conversation today. And if you total up the kind of per year expenditures on TANF and food stamps, it runs at about $70 billion in recent times, and it's up more now because of the recession. But this is a pretty close number. If we added the ITC, we'd probably throw another $50 or $60 billion. But if we think about social service programs funded at the federal, state, and local level and by nonprofit organizations, you see that we spend about well over $150 billion a year on these programs. These are programs that help people find work, keep work, address barriers to employment, take care of basic needs. And so really the kind of key how is we help people through social service programs much more than through cash assistance programs as a safety net. Now, one of the reasons why this shift in how we help matters is a relatively recent shift in our safety net in the last 20 years or so, is that government organizations, I have to keep clicking, sorry. I have to apologize. I had this set to run automatically, and so now I'm clicking. One of the reasons why this shift in how we help people matters is that government and nonprofit organizations are codependent on each other. Government provides a lot of the program funding for nonprofit organizations that deliver these service programs, and nonprofits themselves provide the delivery capacity on the ground. And in my state of Illinois, you see that we spent about $2.5 billion on welfare and food stamps in 2006. The nonprofit social service sector, defined kind of broadly, had revenues of about $6 billion in 2006. And there are a number of consequences of this critical role that nonprofits play. One is that our safety net really isn't a large monolithic federal safety net. It's tens of thousands of local safety nets that are composed of tens of thousands of local community-based organizations, faith-based, secular, that often we think of as reaching the hardest to serve populations, that link communities to resources, that serve as advocates, but also a system that's this decentralized and this dependent on nonprofits encounters some issues of accountability and autonomy. And this image kind of captures, I think, what our local safety nets look like. Some aspects of our safety nets are well integrated. Some organizations are well connected to their populations that they serve, well connected to other organizations. Others are more disconnected or operating in a more isolated fashion. Also, the mix of programs that we have varies by place. So another reason why we should care about how we help low-income populations is that place matters more now in our safety net than it ever has before in some ways. I can mail you a welfare check or a food stamp payment, but I can't mail you job training. And if you don't live near job training providers or if you don't live near quality daycare centers, it's really hard for you to participate in that, no matter how much we spend. What I'll show you here are two maps. And I can show you all kinds of maps, and the story is going to be the same in the different cities I look at, and no matter how I define services. What you see here are orange and red areas, which are hot zones, where access to services is the greatest. And then the light blue and the dark blue areas are colder zones, where access is low, and well below the kind of metro average. And what you notice here, both when we look at access to employment services on the right and access to emergency assistance programs, food, cash, clothing on the left, that in Chicago, the west side and the south side, where poverty rates are the highest, are the areas where access to these types of services is the lowest. And that there are some providers, but they don't actually provide assistance to the commensurate with the level of need in these communities. And so go figure why poverty is persistent in these communities. Go figure why people have a hard time staying on programs, why attrition rates are so high. And actually, even more than just the kind of class differences in access to services, there are profound race differences as well. So predominantly African American and Hispanic communities have far less access to social service programs than white neighborhoods. And I see this in every city I look at. African American neighborhoods have access to about half as many services as predominantly white neighborhoods, and predominantly Latino neighborhoods have about a third as much access, or a third less access. And why is this? Well, one is that there are providers, as I noted, but the supply of services falls far below the potential demand for services in these communities. It's also really difficult to find office space in high poverty areas. Just like there's not a lot of great housing, there's not a lot of great office space. And any provider in this room knows the challenge that they face finding good office space. And also, I think these maps and the findings in my book reflect local preferences of providers for particular populations, particular neighborhoods, preferences for board members, of staff, and I think that comes out in some ways. Another reason why understanding the shift in how we help poor people matters is that there are very few entitlements in the social service sector. We're not obligated to provide a lot of these programs. And so they're often the first things that get cut when we encounter tough budgetary times. And this means that programs are very unstable in some pretty profound ways. 45% of the organizations I interviewed reported losing program funding in 2005, 2006. They coped by cutting services, cutting clients, and cutting staff. And keep in mind, these are data that come from a good economy. And so I think things are more serious now. Rushing along, I would argue that our safety net, actually, how we help poor people through social services, is better connected to our core values than we realize. And actually, we might have some opportunities to cultivate better support or stronger support for programs if we actually thought about this. People prefer that we help families and children. They also prefer that we do it through support services that promote work activity, create opportunity, and access to education. But also, public opinion polls and how people vote with their dollars and their volunteer hours show that oftentimes they prefer to do this through private community-based nonprofits as opposed to large government programs. So what can we do to solve some of the issues I raised today, to make access better, to improve access to programs? One, we can work through community-based organizations. We can use information technology, outreach, to improve links to existing help, right? Some of what we need to do is just connect people better to the help that is already out there. Another thing we can do is think about this suburban, urban, rural dimension, where, as Todd mentioned, poverty rates are much higher in suburban areas than in urban areas, and it suggests that we might have to have regional solutions. But today, the only regional organizations we have are actually large nonprofits that span counties and municipalities. We're very siloed in some ways. I also would like us to think about ways we can strengthen community-based nonprofits, a number of ways of strengthening organizations, and strengthening revenue models. And then finally, I think it's really important for us to maintain our public commitments. One way we're going to have effective programs and be able to implement new solutions is if we maintain our public commitments. In my book, I talk about the subtraction ripple effect. And one of the real perverse realities of the current safety net arrangements is that when we cut federal funding, state funding, or local funding to social programs, social service programs, we're undermining the nonprofit sector on which our safety net is based. And it actually inhibits us not from just helping people today, but helping people 2, 3, 5 years from now. Thank you.